Yes, come in.
Hi, my name is Maya, and I'm going to be your nurse today. How are you feeling?
Good.
Good. Are you having a good day so far?
Yeah.
Okay, good to hear. So I'm going to walk in, I'm going to introduce myself and spark up conversation with the patient. I'm obviously going to wash my hands, do hand hygiene, or as I walk in the room, get some sanitizer. And then before I do anything with the patient, I'm going to get their consent to do an assessment on them. And then I'm going to get her vital signs and her blood pressure, her pulse, her heart rate, her temperature, and I'm going to ask her her pain level. Are you in any pain right now?
Yeah.
Yeah? What would you rate your pain on a 1 to 10 scale, with 1 being no pain and 10 being the worst pain you have ever felt?
I think it's a 9.
A 9? Okay. So with her age being 7, 6, I would use the Wong faces for her to point at the faces that she thinks matches her pain level. And then I would go from there treating. And then I am going to, if she was, let's say on bed rest or not moving for a while, I would obviously do the Q2 turns. And I would also check the bony prominences on the back of her heels, maybe her hips, her shoulders, elbows, just for like bed sores or any open wounds. And then if she was laying down on a pillow, I would check the back of her head to make sure she didn't have any sores or anything. And then if I was able to look, I would look as well. And then I'm going to shine this light in your eye. Ooh, look, it's working. Light in your eyes, okay? And her eyes are reacting and they're brisk, okay? And while I had my pen light out, I can look in her nose. No, it's not working. Have her nose.
I think you
check.
Just hold it.
I would check in her nose, and then I would check in her ears, see if there was any like earwax or drainage that was abnormal. Can you open your mouth for me? I would check in her mouth, see if she had any, see if she had like dry mouth or like white spots or her mucous membranes, if they were pink and moist and stuff. And then I would move down. I'm going to check your lymph nodes. Okay. Can you shrug your shoulders up for me? Okay, good. Can you smile? Can you smile for me? Good job. Okay. Can you feel me touching you? Does that feel normal? Yeah? Okay. Squeeze my fingers as tight as you can. Okay, there we go. All right. I would check her radial pulse. Those are strong. And I would compare both sides, make sure they were both about the same. If one was like diminished or one was like bounding, then we would kind of have to look further into it. I'm going to listen to your heart and your lungs, and I'm also going to listen to your tummy. So when I listen to the heart and lungs, I would listen for 30 seconds, and if I was listening to the apical pulse, then I would listen for 1 minute. And then when I go to the bowel sounds, I would auscultate, or I would inspect, auscultate, percussion, and then palpation. So I'm going to listen to your heart and your lungs. going to listen to your tummy. Okay, are you able to sit up for me? Okay, can you take a couple deep breaths? And one more. Okay, good. Everything sounds good. And then I listened to her stomach, and then I'm going to inspect her stomach, and then I would percuss. Okay, and then palpate. Does this hurt when I push on your tummy?
Yeah.
Yeah. Does it hurt right here?
Yeah.
Yeah. How about over here?
Yeah.
Yeah. It hurts everywhere? Okay. All right. And as I was looking at her tummy, I would inspect her genitalia area, make sure everything was okay. And then I'm going to lift up the blanket so we don't show you off. And then as I was moving down the body, I would check her legs, look for any dryness, edema, cuts or bruises that she has. And then I would check her pulse. Okay, those are good. Those are good. Okay. Can you feel me touching? Yeah? Can you feel me touching over here? Okay, good. Okay, can you push on my hands? Good. And then can you pull your toes towards you? All right, there we go. Okay. And then before I leave the room, I would just ask her if she needed anything, make sure she had her call light, the side rails were up, the bed alarm was on. Do you need anything before I leave? Yes, what can I get you?
Some water.
Some water? Okay, I'll grab you some water. Would you like some ice?
Yeah.
Yes, okay. So then I would leave the room and sanitize my hands and go fetch her water. And that's the end of my assessment.